Hi, Professor Gano. This is Jillian. I'm going to go ahead and show you today on my subject Cody how to dress and change the dressing on a central line. So this is going to be his central line today. So first, before anything, we're going to perform hand hygiene. We can go ahead and do this by washing our hands, or we can go ahead and use an alcohol-based hand sanitizer. So we'll go ahead and do that really quick. All right, next I'm going to go ahead and place some gloves on. Okay, and I'm going to go ahead and clean the surface that I will be using, so just use an alcohol-based scrub for that. Okay. Now I can go ahead and place my equipment on the tray that I'm using. So here I have a sterile dressing change tray with chlorhexidine. Next, I'm going to place a mask on the patient. You. And I'm also going to be placing a mask on myself. To do this, I'm going to go ahead and open up my sterile equipment, and I'm going to carefully remove my sterile gloves here, and then also my mask. And I'll go ahead and keep that closed for the time being. Everything else, for the most part, is going to be sterile in there, so we won't touch anything else though until that occurs. So I'll go ahead and place my mask on. Okay, so now I'm going to go ahead and remove my gloves. And I'm going to just look to see if there's any sign of infection on the central line before I start my process. So everything looks good there. So we'll go ahead and now wash our hands because I'm going to actually be placing sterile gloves on. So I'll go ahead and perform hand hygiene by washing my hands, allow it to dry. Next, I'll go ahead and open up my sterile glove kit. Again, we want to try to do this by not contaminating any surfaces of the sterile gloves. So just keeping your fingers on the outermost portion of the packaging. So first we're going to go ahead and glove our dominant hand, so that is our right. So I can go ahead and kind of open this up in this area with both hands and go ahead and sneak without touching any other surfaces. Right hand in there, carefully rolling that glove up. Next, we'll go ahead and take the dominant hand and we're going to sneak it under this glove here and go ahead and place that one on. Okay, so my sterile gloves are now on, so we can go ahead and carefully move this out of the way. We can also use the sterile packaging as a sterile surface as well. So I'm going to go ahead and just open this guy up here, making sure I'm only touching my sterile surfaces. Okay, so after we apply our sterile gloves, we're going to go ahead and start by grabbing the chlorhexidine wipe. So in here we have the chlorhexidine swab. So we'll go ahead and open this up. Okay. Next, we're gonna go ahead and start by swabbing the surfaces throughout the entire area that we will be applying the dressing and the opening of the central line in a back and forth motion. For about 30 seconds, we're gonna use friction on this as well. Make sure that we get a really good scrub in to try to get it as clean as possible. So. Try to keep the line in place as well. Really scrubbing around that open site. Okay, and then we're gonna allow it to dry. So I'll go ahead and just discard that. Okay, and next, after the area is dry, we're going to place a Chlorohex patch by wrapping it around where the opening of the central line is, where it goes into the skin and the body. We don't have one of those, so I'm just gonna simulate it. So I would open it up and kind of get it loose, and then I would place it around that opening there to where it's around the line, kind of keeping it secure and keeping it as clean as possible, and then just sticking it to the skin. Okay. Then I'm gonna go ahead and apply the skin prep by making a window around the area. So for this, we're gonna use this alcohol swab stick. And we'll go ahead and just make that window. Okay. All right, after we're done making the window, we're going to go ahead and grab the dressing. And we're gonna start off by removing the top portion. So we will actually take this portion off here. Oh, I guess it comes off all at once. So I'm gonna go ahead and just keep that on there. And let's see. Okay. Okay, so that portion is on there, and then we'll go ahead and secure it. So that line's going to be in place there. So typically we have an anchor to go on around this portion, but I don't see it in the kit. I do see some tape, but so we'll go ahead and just simulate with that. So basically you're going to apply the anchor at the bottom. Of course, my tape and my gloves don't want to work together. So we'll just pretend that's the anchor. And then last, we're going to go ahead and use this little guy to put my initials and the date that I changed the dressing, so that we know when to change it next, which usually is in 7 days unless otherwise indicated. So that was the placing of the dressing. Thank you.